Here at St. Luke's Hospital, we're able to provide 7-day-a-week rehabilitation with physical and occupational therapy as well as speech pathology. We're one of the few programs in the area that does provide that level of therapy 7 days a week. You're seeing the physiatrist 6 days a week with 24-hour physician coverage 365 days a year. For a patient, one of the biggest issues after a stroke or spinal cord injury is how am I going to manage when I get out of the hospital? Getting these patients into a rehabilitation program earlier gives us better functional outcomes down the road. Patients who have had a stroke or intracerebral hemorrhage or spinal cord injury, we are seeing that patient typically within 24 hours of their admission to the hospital. We have significantly better outcomes as far as discharge to home in patients who have had stroke. We discharge about 82% of our patients to an independent setting after stroke, after they spent time up on our rehab unit. That compares to the regional average of about 70%. We have a tremendously coordinated care team that provides that. We have a caregiver training program that prepares patients and their families to identify the specific needs that they're going to have upon discharge. The number one strength that we have is that ability to provide care from when a patient hits the intensive care unit right after a stroke or right after a brain injury, providing that continuum of care from the ICU to inpatient rehabilitation to an outpatient day program and then continued outpatient therapy. We will be managing your care throughout that time and we'll follow you for as long as you need to see us. One of the strengths of having an in-hospital-based rehabilitation unit is that we can access the neurosurgeon, the neurologist, the intensivist, the hospitalist, endocrinology. We can access anybody that we would need in a tertiary care setting. We can get CT scans or MRIs while they're in the rehab program, which oftentimes patients would have to be discharged and sent to another facility to get that done. We all take ownership that we all have a piece to give to these patients, and we'll work in a collaborative way to try to provide the best possible care for our patients who have had some sort of neurologic issue.